afternoon. I'm Shawnee Au and this is One News Now. The Agriculture Department reports that only 65 barangays in 13 provinces are still dealing with the ASF or African swine fever. In today's Laging Handa briefing, Department of Agriculture Assistant Secretary Noel Reyes said the number of ASF outbreaks has decreased over the past year. Meanwhile, Reyes also said around 73,000 metric tons of imported pork have arrived in the country. This is to augment the country's pork supply ahead of the increased demand for the holidays.
As of September 23 ay 65 na barangay na lamang po sa 13 probinsya. Lumiliit na po ito, hindi kagaya ng nakaraang mga taon na talagang grabe ang ating pong incidents. At in fact, marami na pong areas dito sa Luzon ang wala ng ASF, no? Karagdagan 5 bayan sa Batangas at yung po sa Benguet, no?
The camp of the suspect behind the death of a cadet in the PNP Academy maintains that there is no probable cause for the indictment. Attorney Jeffrey Udarbe, counsel of Cadet Second Class Stephen Maingat, said the allegation against the cadet is false. Udarbe also said they're now questioning the legality of Maingat's arrest, which led to his detention in a local police station. The suspect is facing administrative and criminal charges under the Anti-Hazing Act after he allegedly bogged down Cadet Third Class George Magsayo.
Kasi una sa lahat, yung wala namang hazing na ang may gawa lang ay isang tao. And at the same time, yung allegations against him, aside from false, kulang din. So as to properly charge him for the
COVID cases and virus reproduction rates are on a decline in Metro Manila and other nearby areas. However, both the Health Department and the OCTA research team are warning that we're not completely out of the woods just yet. Here's the report.
Several areas in the country are still seeing a surge in COVID-19 cases due to the Delta variant. That includes Region 1, 2, 4B, 5, CAR, and certain areas in Regions 3 and 4A. But in other areas like Bulacan, Cavite, Laguna, and Rizal, cases are already on a downtrend. Still, the Health Department says it's not the time to let our guards down.
Bagamat nakikita natin ang unti-unting pagbaba, nakita po natin in the previous week, bumagal po ang pagtaas ng mga kaso.
Vergere also urged caution when interpreting recent COVID-19 data. She said more and more people are now relying on antigen tests instead of RT-PCR tests. Recall that the agency will only start counting antigen tests in their daily case tally starting this week. Vergere also cited challenges in counting antigen test results. She said out of 6,000 antigen tests submitted to the agency for validation, only about 300 were found to have been administered properly.
So ito lang po ang pwede naming isama out of this many antigen tests because people are using this for screening borders, screening for work and activities, and that is not right or proper use of antigen at baka magkaroon tayo ng inaccurate results.
The Health Department is now working with the MMDA and the National Task Force to mobilize regional offices of the DILG and DOH in establishing a registration and reporting system for clinics and LGUs using antigen tests.
Unti-unti na po nating ipapasok itong mga positive results ng antigen test after we validate ito pong mga naire-report sa atin.
The OCTA research team is likewise reporting better COVID-19 numbers, but the group is not convinced that Metro Manila should now be classified at moderate risk.
We're not seeing the moderate risk level yet because hospitals are still full. The healthcare utilization, we see it at high level, and the daily attack rate, ADAR, we still see it right now at critical level.
Despite this, OCTA believes the implementation of the new granular lockdown and alert level system is showing good results.
We're gonna pause for a quick break, but we will be back with more stories after that. Stay with us. You're back on One News Now. I'm Sean Yao. Some governments are considering the use of booster shots, at least initially for vulnerable sectors. However, most experts are still not convinced that there's enough data to justify the use of an extra shot. Let's hear the details from Bloomberg.
I know it's difficult to answer, but do I need a booster or not? And do I listen to the CDC or the FDA?
Well, at the end of the day, we're going to go with the CDC guidance that came out late last night. And that essentially boils down to if you're over the age of 65, you're eligible for a booster. If you have an underlying medical condition and you're 18 and over, you can get a booster. And if you're in an occupation that puts you at increased risk of coming in contact with individuals who might be COVID-19 positive, for example, hospital workers, long-term care facility workers, you're also eligible for a booster. So it's a rather broad swath of the population that will now be eligible for boosters here in the U.S.
Andy, you're in this profession. You've been watching the will they recommend boosters or won't they recommend boosters debate that has caused people to resign within some of the regulatory agencies in the United States. Have you ever seen such a public disagreement and a messy rollout of health policy before in your tenure in the field?
It's a really difficult time right now. It's clear that there is lots of data suggesting that boosters in the over 65 and those with medical conditions predisposing to severe COVID, boosters will help those individuals because it will boost their protection against severe disease. The debate really comes for the rest of the population. The data suggesting that boosters are going to be worth the extra protection that they might give is really not there. It makes sense to try to protect our healthcare workers, for instance, and so logically speaking, it's something that we should really consider, but the data isn't there in terms of how useful these boosters are going to be, and that's where the debate really is falling in.
Well, here's my issue with this, Andy, is the fact that we're talking about boosters really applies to only people that already wanted the vaccine. And there are still millions of people across the United States who remain unvaccinated. How damaging is this kind of mixed messaging from regulators, from science officials who people have been told to trust? to those who have decided that they don't want to get their shots.
This is such an important point, and it was really discussed in great detail at the CDC meeting yesterday. You don't want to send the message that essentially everybody needs a booster, because that implies that the vaccines aren't working. The vaccines are actually holding up fairly well, even with this onslaught of Delta, which is a variant that is much, much more dangerous than any previous SARS-CoV-2 variant that we've seen so far. So the critical thing to get this pandemic under control, particularly here in the U.S., but also globally, is to get unvaccinated people vaccinated. Boosters have a role, and again, we want to protect those vulnerable from severe disease, but this discussion of boosters is sort of taking away from the critical point for controlling the pandemic, which is unvaccinated people.
Well, and we know that there are pockets of unvaccinated people. It has been quite regionalized. Among those pockets includes a lot of the South, but we are actually starting to see cases decline in many of those areas. Should we take solace in that?
Well, you know, the infection has really burned through a lot of populations. We're getting immunity, but we're getting it in the wrong way. We're getting immunity in the population through infection, through hospitalization, through stress on the medical community, and we're only now going to start to see the effects of long COVID, which we haven't discussed yet because we've been so focused on the acute cases. But many of these individuals are going to start suffering long-term consequences from their infections, and we'll deal with that over the next 6 to 9 months or even longer than that. So it's such an important part of the discussion that has been sort of, again, not really the focus.
And more establishments will be allowed to reopen once Metro Manila downgrades to Alert Level 3. Maricel Halili joins us live from Mandaluyong City for more details. Which establishments will be allowed to open further or operate further under Alert Level 3, and when will we be under Alert Level 3?
Well, Sean, basically, it will be the same establishments that are allowed to open under general community quarantine. Alert level system basically just adopted the policies under GCQ, MACQ, and ECQ. So we just have to check the same list. The clear difference between Alert Level 4 and Alert Level 3 is the number of percentage, or the percentage of customers who will be allowed to enter establishments such as restaurants, barber shops, and hair spas, and nail salons. So from the current 10%, we can expect around 30% seating capacity, which will be open for customers once they have decided to place Metro Manila under Alert Level 3. As to when they will announce it, Malacanang said that, or the Department of Health will be in charge of announcing what particular alert level are they going to impose. And based on the statement of DOH earlier, they will announce it on or before October 1.
All right. So will there still be restrictions in place, for unvaccinated people? Because right now it's like it's a mix. Like vaccinated people can go here, and unvaccinated and vaccinated people can mix outside. Where will there be such distinctions under Alert Level 3 still?
Trade Secretary Ramon Lopez explained earlier that maybe once the DOH decided to place Metro Manila under Alert Level 3, maybe they can relax the requirements of vaccinated people to enter, that only vaccinated people can enter the restaurants. Maybe they can relax that particular policy, considering that they also don't want criticisms that they are imposing discrimination among those people who are vaccinated and unvaccinated.
Right, so I guess the question now is, how do officials expect a downgrade to Alert Level 3? How do they expect this to impact the economy? Obviously, it will be more positive, but is it really enough, Maset?
Well, for now, based on the data gathered by the Department of Health, it seems that we're still far from imposing Alert Level 3. as recommended by the MMDA. They are still closely monitoring the healthcare system, particularly here in Metro Manila. Some cities here in Metro Manila are still at high risk when it comes to the ICU utilization rate. So, of course, they have to consider that. But let's wait and see what will be the decision of the Department of Health come October 1.
All right, we'll wait for that. Thank you so much for all those updates. Maricel Halili reporting to us live from Mandaluyong City. Thanks, Mase. Here's a quick look at today's other top stories. PNP Chief Guillermo Eleazar has approved the nomination of Police Major General Alexander Sampaga as the new director of the PNP Academy. This comes after the alleged hazing death of Cadet 3rd Class George Carl Magsayo by another cadet who is now detained at a local police station. A criminal case has been filed earlier today. Formerly Executive Crizel Mago has been refusing to answer the Senate's call after her testimony. Lincoln Ong, another formerly official, has requested for an executive session, prompting authorities to postpone his transfer to the Pasay City Jail. And Miss Universe Philippines 2021 wrapped up its preliminary competition that was held at the Clark International Airport. The 28 candidates sizzled and strutted down the runway, wearing their swimsuits and their evening gowns. The coronation for this year's Miss Universe Philippines will be held on September 30 in Panglao, Bohol. For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.